Hey, what's going on, everybody? It's your girl, Freddie, and thank you for tuning in to the Focal Spot podcast. This is the spot where you get to hear thought-provoking topics, interviews with celebrities, and much more. Make sure you follow me on Instagram, YouTube, Facebook at The Focal Spot, where I will post past and upcoming interviews. Today, I have a guest. She is a OBGYN based out of Tennessee. Dr. Rosalyn Porter stops by the Focal Spot to talk about uterine fibroids, endometriosis, PCOS, and much more. Let's welcome to the Focal Spot, Dr. Rosalyn Porter. Dr. Rosalyn Porter, what are uterine fibroids?
It is an overgrowth of the normal muscle tissue that is found in the uterus. So your uterus is made up of layers. There's the outer layer, which is just kind of like the skin of the uterus, and then there's a layer of muscle, and then there's an inner layer, which is your endometrium, or the lining that sheds when you have your period. So what a fibroid is a overgrowth of the muscular layer of the uterus. Fibroids affect women in a lot of different ways. Fibroids are the most common pelvic tumor. Any overgrowth of tissue is called a tumor in women, and it is the leading cause for hysterectomy. So fibroids affect women on a spectrum. Women can be asymptomatic, meaning they don't even know they're there unless someone tells them, or they can cause abnormal uterine bleeding, which is the number one issue. Some women who have fibroids bleed so much that they are severely anemic. Other symptoms, they can be really heavy or get really large and cause pressure symptoms, pelvic pressure, pelvic pain, problems with urination, constipation, or other issues with having bowel movement. They can cause pain with intercourse, and also just a general sensation of fullness in the pelvis.
I know with my personal experience with fibroids, other things that I did notice was my hair started thinning, and I gained some weight that unexplainable. Of course, when people think of weight gain, they think you're eating too much. But I'm like, nah, I don't think that's it. Especially when you gain 50 pounds in a short period of time. And also, my stomach looked bigger, but I come to find out it looked like it was swollen.
So different women experience different things as far as what the fibroid can do. The things that I discussed are the most common symptoms. The things that you have been experiencing, while uncommon for the masses, can definitely be very specific to you, secondary to the fibroids. They usually are what we call hormonally responsive, which means that your body produces estrogen. Estrogen can make them grow bigger and faster depending on how much estrogen you have. And then it's a cycle where your stomach looks bigger, you are gaining weight, and as a side effect from weight gain and all those other things, you can definitely have hair thinning and other not as common symptoms as the bleeding and the pressure.
What causes fibroids?
That is something that we don't know. They've been linked to diet, and I'm using the word linked because there's no direct cause and effect. Like, if you do this, then you won't get fibroids. What we do know is that they are more common in the Black and Latina communities. 80% of women have them by age 50 in our Black community. We know that they can vary in size, the number and locations, all variants, but we don't necessarily know what causes or what leads to fibroids. Again, we do know that estrogen, which is your hormone you naturally have in your body as a woman, can make fibroids grow larger. And women who have excess estrogen, if you're overweight to obese, you can have excess estrogen, which would put you at risk to develop fibroids at a more rapid rate.
It's interesting that you say diet. Is it diet that produces a lot more hormones? Which part of your diet that people have suggested that might be linked to fibroids?
We are using a lot of genetically modified organisms as we're eating. GMOs, what they're feeding the animals. They give animals things that may have estrogen levels or things that act as estrogen that can trigger the growth of fibroids. Other things like soy products can have that same hormonal effect that can trigger the growth of fibroids. Again, we don't know. There are no direct links, and a lot of these things are just theories. But diet is one of those things that could be a contributing factor to the development of fibroids.
I remember growing up, it seemed like having a painful menstrual cycle or having a painful period was like the rite of passage for women. Are periods supposed to be painful?
No. Is mild cramping common? Mild cramping is very common. Some women experience the mildest of cramps, but your period is not supposed to be painful. You're not supposed to be doubled over in pain, unable to concentrate, taking off days from school, taking off days from work. That is what we call severe dysmenorrhea, and it needs to be evaluated.
Now, I know a lot of my friends growing up, when they said they had irregular cycles, that many of them were treated with birth control. What are the pros and cons of using birth control to regulate your menstrual cycle?
There are a lot of different pros to using birth control to regulate your cycle. Number one, the longer you are on birth control, the less painful and the lighter your cycles are. That's the first thing. Number two, you are regulated. If your period is unpredictable, you don't have to worry about messing up your clothing or not being prepared for that time of the month. The predictability of when your period is going to occur when you are on birth control is a positive thing. Number three, depending on what type of birth control you use, it offers some protection. The birth control pill has been shown to decrease your risk of ovarian cancer overall. The longer you're on the pill, the less risk you have overall. And the reason why is because the less you ovulate, the less likely you are to be at risk of ovarian cancer. Other pros to birth control are it can clear up your skin if you have acne. If you have heavy bleeding, as bleeding will get lighter over time. And then, of course, if you're taking it for contraceptive reasons, then if you are taking your birth control as directed, it's up to 99.9% effective as far as preventing pregnancy. Now, the cons. The cons of birth control vary from person to person, and it really depends on your medical history and how healthy you are and what your family history is. If you are pretty healthy, you don't have any medical problems like blood clots, migraines, a strong family history of breast cancer, anything like that, then your major con is going to be dealing with the side effects. The side effects of birth control can be irregular spotting for the first few months. You may have the sensation that you're hungry, which leads you to eat more, which leads to weight gain. You may experience mood swings, irritability, bloating, breast tenderness, all of these irritability symptoms that mimic the first early months of pregnancy. All of those things can be considered a con for women who don't want to be uncomfortable. And those symptoms can last for up to 2 to 3 months or until your body gets used to the hormones. I think as far as the cons are concerned, we're talking mostly side effects from the pills, from the patch. But if you have any medical problems, any birth control with estrogen in it can increase your risk of developing deep venous thrombosis or blood clots in your legs, which is why it's really important to give your doctor a very thorough medical history and family history when you're considering starting a contraceptive method.
It's funny that you mentioned family history because, again, I do notice that when I have spoken to like the few people that I know, when they ask their mom, they have it, but they didn't know about it. So it's interesting gathering family information that family don't want to give.
Yeah, it is. I mean, we don't necessarily talk to our family about what's going on in their medical history, especially the intimate medical history, like what were your periods like, or did you have any side effects when you took birth control, or have you ever been diagnosed with a breast cyst or mass or lesion, and have you ever had an abnormal pap? And, you know, all of these things that we don't necessarily talk to the women in our family about can be really helpful when deciding on what's best for you.
Earlier you said that periods should not be painful. How can women or teenage girls detect menstrual cycle irregularity?
With teenage girls, it always depends on when you started your period. Because as your body matures, you're going to have a little bit of irregularity, which is considered a normal maturation process. So if you start your period at 11 or 12 or however old you are when you start your period, you should allow your body 2 years to mature. Within those 2 years, you expect irregular periods. You expect you to have your first period and may not have another one for a while. We expect that first period to be kind of dark and not necessarily a full-on flow. But after that 2 years, we expect your periods to become what's normal for you. And what that means is we're looking at a cycle reoccurring frequency of anywhere from 28 to 35 days is considered normal. While 35 days is a little bit on the longer side, if it's a consistent every 35 days you're starting your period, then that's considered normal. So after the 2 years, like I said, you want to know what's normal for you as far as how far apart your periods are. You want to know what's normal for you as far as, do you get cramping with your period? Do your breasts get tender before your period? Does your vaginal discharge change anytime in and around your cycle? Do you get mood swings? All of those things are going to be very important as you progress in your reproductive life. Again, having severe pain with your periods is not necessarily normal, and it could indicate that you have a condition like maybe fibroids or maybe endometriosis or severe dysmenorrhea that requires some type of treatment. But the most important thing is to let your body mature. After those first 2 years, figure out what's normal for you and trend any type of things that may be different from month to month. So if you are concerned or you do become concerned, you can have all this information to share with your provider.
Can you explain the difference between endometriosis, polycystic ovarian syndrome, and fibroids?
Sure. Endometriosis is, we spoke earlier about the layers of the uterus. We talked about the skin, the muscle layer, and then we talked about that inner layer, which is called the endometrium. For reasons not 100% understood, the inner layer of your uterus, which is the lining you shed, and that's what you see when you have your period, sometimes that layer can create deposits outside of the uterus, meaning they can be in your abdomen, in your pelvis, but outside of the uterus. They can be on your ovaries, your tubes. They can be on your bladder. They can deposit in between the space between your bladder and your uterus. They can be in between the space between your uterus and your rectum. All of these things. And what they do is they act just like the lining of your uterus. Every month they get inflamed, and when you have your period, they can create pain. And the reason why it's almost like you're having a period outside of your pelvis. Now, your pelvis isn't filled with blood or anything like that, but these lesions can create the same type of inflammation and shedding type of process that occurs with your uterine lining. Women who have endometriosis have pain. It's a cyclic pain every month around the same time. They get excruciating pain. And it may not be cramping. That's the mild cramping that's associated with their period. People have described this pain as sharp, gnawing. It's pretty significant and very severe. And a lot of times with endometriosis, we reach a treatment wall because the pain is so severe that birth control doesn't necessarily work. The usual pain medicines, ibuprofen, and all these things that we apply before we go into surgical procedures don't work. And a lot of times those young ladies need a diagnostic laparoscopy, or when we put a camera inside your belly to actually visualize this tissue and ablate it or try to destroy it in order to prevent the monthly cyclic pain. So endometriosis can be tricky. A lot of times we don't diagnose it right away because it's not something you just want to say, hey, you're having painful periods, you have endometriosis, because the implications of endometriosis can be so severe, and they can also lead to infertility in worst case scenarios. Uterine fibroids are overgrowth of muscle lining, and different women react to fibroids differently. It depends on their size, the location. Fibroids can be in right up under that first layer of the uterus. They can be right in the middle of the muscle, or they can be impinging upon that inner layer. Those are the ones that you see when they impinge upon the inner layer. Definitely a lot of dysfunctional uterine bleeding. These women definitely bleed a lot and can even bleed to the point of needing blood transfusions because they're so anemic. Fibroids can cause pressure symptoms, can cause problems with defecation, urination, and we have several different ways of treating fibroids. We can treat the fibroids themselves, meaning I can take just the fibroids out. We can do a radiologic procedure where we can put material in your blood vessels so we can shrink the fibroid. There we can do hormonal therapy, because if you are on any type of progesterone type of birth control, over time they will get smaller, and hopefully we can control the bleeding that way. In cases that we have not been successful doing other things, there are things you can go to hysterectomy. So there are different ways of treating fibroids, and anytime we treat fibroids, we should take into account whether or not this woman has had children and what her desire for children is, and counsel them appropriately based upon their reproductive desires. And then with polycystic ovarian syndrome, that is a constellation of symptoms. It's a process that can cause you to have irregular periods, and because your periods are irregular, you're likely not ovulating, and the lack of ovulation can lead to problems with conception and fertility issues. A lot of women with polycystic ovarian syndrome can also have other conditions, including problems with processing sugar to the point of overt diabetes. Some women have problems with hirsutism or hair growth on the face or male pattern hair growth. And then a lot of women who have PCOS also have problems with weight and obesity. So PCOS is a condition that we have to approach from all angles. We have to know what your periods look like, and we need to know as much information as possible. There again, if you are creating this journal of what's normal for your periods, it really can help if you're having any type of abnormality. Like, we're going to want to know, how often are you getting your periods? The further back you can go and the more information you have, the better. Do you get breast tenderness? Do you have a change in your cervical mucus? All of these things will let us know if you are indeed ovulating. After we talk about your menstrual cycles, we want to talk about your weight. Has it changed? Is it more? Is it less? And if so, over how much time did change occur? Hair growth pattern. We'll want to know about your diet. We'll want to know all sorts of things, because PCOS is something you have to look at globally, and the way we treat PCOS depends on the woman's desires. Are we treating PCOS because you want to have a period every month, or is this PCOS treatment because you want to be pregnant, which is a very different approach depending upon what your reproductive desires are at that time. PCOS is very tricky, and it's a very multifaceted condition.
It seems like with all three, if you do notice irregularities, go to the doctor.
Right. And I think that that's the biggest thing that you can take away from this is it's a really important thing to keep track of your period. There are so many women that I discuss these things with, and a lot of times they come to me and they have this complaint that their periods are irregular. And I'm like, what does that mean for you? What were they before, and what are they now? And when did the irregularities start, and what are you noticing that's different? And a lot of times women can't answer those questions. So it leaves me unable to pinpoint which category of abnormality we could be dealing with. And it's helpful for the physician, it's helpful for you. And also, if you know what's normal for you, you'll know when something's not right. And so keeping a Menses journal, or just kind of paying a lot more attention to your cycles, is a very important thing. And it can save you and your doctor a lot of time when you're trying to figure out what's going on or what I can do to make myself feel better.
I'm definitely going to chime in. My doctor didn't want to believe that I had menstrual issues until I was able to provide him a 2-year situation, which really is more than 2 years. I was 28 when he finally diagnosed me with fibroids, and he was surprised because he said, I'm actually very young to get fibroids, and I probably had it when I was 27 or even earlier. But it was because I was able to tell him, hey, I noticed this month it didn't come at all. This month it came 2 weeks. This month I could not walk. And then he also did a pelvic exam, and he found out I also had a cyst too. So I had two things going on with me.
And it's so unfortunate. I think that sometimes people in my profession do a disservice by not listening as much as we should, but also having that information makes it undeniable. And I think that that's something that I want people to know. Having that information makes everything more valid. So the more information you can give to document what you know is wrong because it's your body, the better. And that's really that you went back and you talked to that person and you got them to listen to you, because a lot of people don't, and they just end up going to a different physician because they feel like they're not getting what they need elsewhere. And that can also be helpful, but at the same time, then a lot of physicians have to recreate what you've already had done because there is a standard way that we do things.
Are doctors supposed to ask you about your cycle, or you're supposed to bring it to their attention? Because I've noticed if you don't ask, they don't ask either.
OBGYN doctors, we are supposed to ask. And that's just because the menstrual cycle can give you a lot of information, like even just the basic questions. When was your last period? How long did it last? Was it painful? How often do you get your periods? Do you get your periods every month? So those are my standard questions I ask all of my patients that come in to see me for annual exams, because I feel like those questions will get me to, if there's a problem, they will say it. Like if I say, hey, when was your last period? And then they go, my periods are irregular. Oh, what does that mean for you? Or my last period was this day. How many days did it last? It's like, girl, my period lasts 10 days. Is that normal? Does it always last 10 days? How heavy is it? Now I'm prompted to go into something else. Or if the answers to those first two questions are normal, then I can say, hey, do you have pain with your periods? And then that's a whole nother can of worms that I've opened, and that can lead me to a diagnosis or to identify a problem. So yes, I think that it should be a part of our annual exam. It should be a question that we ask.
Not only doctors are supposed to ask women about their cycle since they are OBGYNs,
That's what we do. Right.
Also, women are supposed to keep track of their cycle and realize any pain is not normal.
I definitely agree with that. I think that physicians in my field should be using the menstrual cycle as kind of a vital sign and something to pay attention to, and maybe that'll alert us to other things that might be going on with the patient. And as a woman, please keep track of your menstrual cycles. It's a huge help. And look, if you want to have a baby one day, knowing that you have regular periods and you have breast tenderness before your periods, or you have symptoms that are consistent with ovulation, that'll be helpful for you. And if you're not getting pregnant as quickly as you would want, and you have all this information, you will be so happy that you did. And of course, it's a way to make sure that everything's in working order. You're not having any pain. It's not all of a sudden irregular, or the cycle length isn't longer or shorter, or any number of things. So I definitely think that keeping track of your menstrual cycles is very important.
How come fibroids is so common, but yet not as talked about as breast, lung, or heart cancers, or even HPV?
I think the answer to that is the word cancer kind of trumps a lot of things that are considered benign. Okay, so it's like, well, fibroids can cause all these problems, and they're very common entities. I see them all the time, whether you have symptoms or not, but it's not going to kill you. And I think that that's probably why they don't get as much attention, or it's not this loudspeaker like, hey, ladies, fibroids. And I think that that's why. I think that it's just a very common condition that is the most common reason for women to have hysterectomies in the first place, but they're not cancer. And so since it's not cancer, and since it is a benign condition, I think a lot of benign conditions that can be life-changing, but they're not life-threatening, they kind of get pushed to the sidelines and not talked about as much.
Life-threatening is one of PCOS, and it causes infertility.
Right. It's life-threatening in the sense that you can't conceive, but not in the sense that your life expectancy has been shortened.
So how early can women get fibroids?
That's a great question. And I think that they tend to develop mostly in your 20s. I have not seen them in the pediatric population as much, but I think that most people tend to develop them in their early 20s. And then once they start to grow and get bigger, and then if they start to cause problems, most people notice in their late 20s, early 30s. But what's going to happen in your 30s is that if they're going to grow and if you're going to have them, they're already there in your 30s, and by this point, they're causing problems.
Dr. Rosalyn, it was a pleasure talking to you, the flyest doctor in Tennessee.
Thank you, hon. I appreciate you.